Why are ICD-10 and CPT codes important for your surgery recovery? Imagine trying to explain your recovery to a new doctor or insurance company without clear details. It would be like trying to find your way in a city without a map. That's where ICD-10 and CPT codes come in. They are the tools that help keep your medical records accurate and organized. These codes are used every time you visit your healthcare provider after surgery. They tell the story of what was done and why. ICD-10 codes are diagnosis codes. They describe your medical condition, like if you had a broken bone or an infected wound. They also show the reason for your follow-up visits, such as routine healing or complications like bleeding or infection. For example, if you are healing from a knee replacement, a code in the Z category might be used to show your visit is for follow-up care. These codes make sure your medical records clearly show your health status after surgery. CPT codes are procedure codes. They specify what services or treatments you received. This can include the surgery itself, pre-surgery consultations, or follow-up treatments like injections or physical therapy. For example, if you had a physical therapy session after surgery, a CPT code would identify that specific service. These codes help your healthcare team and insurance companies know exactly what was done during each visit. Having accurate codes on your medical records is very important. They help ensure your care is properly documented, which is essential for tracking your recovery progress. If there are complications, specific codes can show whether you needed additional procedures or treatments. This helps your healthcare team spot issues early and adjust your recovery plan. Insurance companies relying on these codes to decide if your treatments are covered. CPT codes justify the services provided and determine how much your insurance pays. ICD-10 codes show the medical necessity of each visit or treatment. Correct coding prevents delays or denials in insurance claims, so your recovery care is paid for without hassle. When you go to your follow-up appointments, the right codes are used to document your visit. This documentation supports your recovery plan and helps your healthcare providers communicate with insurers. If you need to return to surgery or get additional care, specific codes make sure those events are recorded accurately. Understanding these codes helps you see why detailed documentation matters. It's not just about paperwork. It's about making sure your recovery is well tracked and supported. Your healthcare team asks questions about your symptoms and progress during visits. This information helps assign the correct codes, which then reflected your actual care. Clear, accurate codes ensure everyone is on the same page, making your recovery smoother and more effective.